talk about the report which I've been working on with colleagues at the Institute for Research on Poverty. And this is part of the Wisconsin Poverty Project, and we actually developed a new measure of poverty. So I have to give a little bit of methodology, but I'm keeping this limiting this to 3 slides. But let me first tell you, this Wisconsin Poverty Project, so we're trying to develop a more comprehensive measure of poverty that we think will do a better job of capturing the effects of public policies on the poverty. And we tailored this poverty measure to Wisconsin, so it includes things like the effects of the homestead credit, which isn't in Wisconsin and might not be in other states, and our state EITC is included. We're doing this in Wisconsin, but we're also trying to provide a model for other states and localities to follow. The federal government also has been working on a better measure of poverty. We've actually been working on this, I would say, my entire career, but it dates back further than that. Well, I guess in '95, the National Academy of Sciences came out with a report saying we should have really a better measure of poverty, and we've been working to try to do that since then and before then. Our current measure dates from the 60s. So you may be hearing in the next month, or you may have already heard more about this new supplemental poverty measure. The results for 2010 should come out in the next month. We've been developing our measure in Wisconsin sort of simultaneously with the development of the federal measure, so they're not identical. But what I'm telling you about the Wisconsin poverty measure will help you understand what's in this new supplemental measure that's about to come out. Going to a meeting on November 7th where we're in constant conversation as people across the country are developing different poverty measures. So this slide worked fine in my PowerPoint, which is the old version. So I'll tell you what the visible numbers are. I'm going to talk about how we measure poverty. That first box, which you can't see, says, what's the level of need? So you have a threshold. Above it, you're not poor. Below it, you are poor. The second box is supposed to say family resources. Are your family resources big enough to keep you above the threshold or below? And then the last is just the family unit. So for the official measure, we have this official poverty line that was developed in the 1960s based on the cost of food, and it's been adjusted for inflation since then. We compare that, so it's been adjusted for inflation, but it hasn't been adjusted for all the changes in what we spend money on since the 1960s. You know, we didn't have the health insurance costs, the child care costs, we didn't have cell phones, laptops, it was a very different world, and so just to take the old poverty line and adjust it for inflation doesn't fully capture poverty in most researchers' perspective. What we do is compare that to cash income, not counting your food stamps, which didn't exist in 1960, and not counting your tax credits or how much tax is taken out of your paycheck. So it's sort of a simple method. It's still a good method. It's still what we will be using to measure whether someone's eligible for food stamps, but for research purposes, people want a more comprehensive measure. And we do it by the family unit. So this new measure, we are doing something similar to SPM stands for the supplemental poverty measure, which is being developed at the federal level. We adopted their threshold, and you look at, I won't go into all the details, but they add up what families spend on food, shelter, clothing, utilities, and they add 20% for everything else, and that's sort of a basic minimum of what families need, and they look at what families are about the 33rd percentile of spending. Then we adjust it for Wisconsin cost of living. The poverty line is the same in Wisconsin, New York, Hawaii, Alaska. Well, Hawaii and Alaska are adjusted, I'm sorry. Continental United States is all the same. So we also adjust it for housing, tenure, and medical expenses, as I will explain. And then for the family resources, we don't just look at cash income, we add in tax credits, which are usually positive, and then taxes you pay, which subtracts from your income. We add in non-cash benefits. We add in, take out work expenses like the commuting costs and child care costs are particularly large. And the family unit we include, if you're living with an unmarried partner, that person counts as your family. And there's a little technical glitch that foster children were left out of the poverty counts in the original official measure, and we correct for that. So just to give you a sense, the official poverty line in 2009 is about 22,000. It's about the same today. Inflation hasn't been too much. I didn't ask you what you thought a family of 4 needed. If you ask Americans, they say about 45, 46,000 just to get by, not to be hugely rich, but to sort of be getting by. And so the poverty line is really quite low relative to what people think you need. The median household income in Wisconsin is $50,000. Now, this threshold that's been developed sort of following the National Academy of Sciences recommendation from '95 is higher, not high, it's higher. But what we do is we adjust for cost of living, and actually it does cost less to live here than in the country as a whole, if you count some of how expensive New York is, or some of the more urban areas. And so our threshold we start with is about $24,600. I'm afraid I have to complicate the picture because we adjust for things like if you have we adjust for medical expenses which aren't included in the original threshold. So we just think if you're elderly and in fair health, you're likely to have out-of-pocket expenses for prescription drugs and things. And so we give you need more money instead of needing, if a family that wasn't elderly and didn't have these expenses was at almost 25,000, they need an extra 2,000 a year just to cover sort of standard medical expenses. Then we lower it for families that already own their home, because you don't need as much. What you need to get by is less if you don't have a mortgage on your house. These two sort of cancel each other out, and the elderly tend to have high medical expenses, but some of them, a fair number, own their own home. Oops. I think I didn't do it in this slide, but it turns out that if you're non-elderly and in good health, but pay private insurance, you also need a higher threshold because of the high cost of health care. Yes, the question, I'm sorry.
Yeah, if someone is elderly, what's the probability of having a family of four? Help me understand.
Yes, good point. I guess if you're elderly, you have less chance of being a family of four. So these thresholds, they then are adjusted by family size. And the family size adjustment is actually also improved from what it was under the official measure. The official measure also assumed that single elderly and two-person elderly had lower expenses, and so they sort of did this technical adjustment, and we don't do that anymore, and so we actually will find higher elderly poverty rates than you find under the official measure. Thank you for, yes, this is just a family of four. A family of three, this baseline, the 22,000 is about 17,000 for a family of three, just to give you a sense of the economies of scale.